The best indicator of the health of any population is the death rate. According to the CDC, non-COVID excess deaths are up across the country, so much so that the chief of the mortality statistics branch of the CDC actually said, "We've never seen anything like it." Excess deaths are up in Virginia 13%. It seems confusing, but all these terms are really simple. All-cause mortality simply means all of the deaths for all causes in a given time, typically a year. By averaging together all of the deaths of several normal years, we can estimate how many people would be expected to die in a given year. If more people die than expected, then that is referred to as excess deaths, more than expected. If we have excess deaths, that's an indication that we have a problem. Let's look at the CDC data for Virginia. This chart is based on averaging the last 5 normal years, 2015 to 2019, the 5 years before the pandemic. 0 is the number of expected deaths. So this chart counts how many excess deaths in each year. In 2020, excess deaths were up 8.9%. We had COVID, so that seems reasonable. In 2021, excess deaths were 16.5%. In that year, we introduced the vaccine, so it seems as though excess deaths would be down, but instead they increased. And in 2022, excess deaths to date are tracking 2021. Right now, 13.4% higher deaths than expected. So now we have high vaccination rates. We have less fatal variants of COVID. So why are the excess deaths still rising? Increasing deaths at the end of a pandemic indicate that we still have a problem. The CDC has identified 13 non-COVID causes of death that began during the pandemic, and they actually started tracking those in 2020, February of 2020. And again, by the CDC's own data, Virginia is currently 9th in the number of excess deaths that are not attributed to COVID. We can take a closer look at Virginia's data in the CDC records. The number of all-cause excess deaths in Virginia show about 12,000 Virginians who have died of the 13 tracked non-COVID deaths. And this is since February of 2020. And the way the Virginia Department of Health has explained that they recorded COVID deaths during the pandemic, these numbers could be significantly higher. And remember, this chart only counts how many people were so sick that they actually died. An increase in deaths for a condition logically means that there was an increase in the number of occurrences. How many were non-fatal? How many people are seriously ill with these 13 non-COVID conditions, affected for life, disabled, or possibly facing an early death? I'm Delegate Karen Greenhalgh, and as a member of the House of Delegates in Virginia, I've been appointed to the Joint Commission on Healthcare. Through my business, I've been certified in healthcare privacy, compliance, and security. And as delegate, I really enjoy going to meet my constituents to hear their opinions, their concerns, and tell them how I get to serve them and represent them in Richmond. When I tell them about my studies and my research into the excess illness and death issue that we have here in Virginia, they very often encourage me to continue by sharing their stories. For instance, one man told me that he had a sudden spike in his blood sugar. His doctor was caught off guard because it was a very serious sudden spike, and they're still struggling to manage that with medication. The doctor said he'd had several patients that had a sudden dangerously high blood sugar spike, and he's trying to figure out what those patients have in common so that he can hopefully figure out what was the cause. And then another constituent told me of a sudden onset of a heart condition that required emergency surgery to save his life. And he and his doctor both were surprised because there was no indication of this illness. And the doctor made it clear that it's not something that typically comes up unexpectedly. I've been told of young people, several young people, who have cancer. And these are cancers that are not typically found in those who are so young. And I was told just yesterday that one of these young people passed away. There are stories of heart disease, kidney failure, blood clots, just stories from people who know from their experience and their families and friends that something's just not right. And the most touching for me was the pastor who has served the same congregation for decades. And he said he's just tired because, in his words, I've never seen so many people so sick. So as delegate, I'm working to get the data that we need from many different sources to confirm the CDC indications that we have a healthcare crisis in Virginia. And if I can identify the problem, I want to know who's getting sick, why they're getting sick, and what can be done about it. According to the evidence from the CDC, it appears non-COVID illnesses and deaths began during the pandemic, began increasing, and continue to increase. I'll keep working hard to get the data and to figure out who's being effective and how we can help. Thank you for watching my video. I will be sharing updates as I get information, so please follow me on Facebook and Twitter. You can go to my website, KarenGreenhalgh.com, and sign up for my newsletter. And if you would like to share your story with me, you can do so at my email address, contact@KarenGreenhalgh.com. Thank you, and I look forward to speaking with you again soon. I am Karen Greenhalgh, and I authorized and paid for this video.